The movie Fight Club portrays a narrator grappling with several different mental illnesses, primarily driven by societal pressures and a deep sense of alienation. While the film doesn't offer a clinical diagnosis, we can analyze his behavior and experiences to speculate on possible diagnoses and treatment approaches. Some possible diagnoses and treatment approaches are DID, dissociative identity disorder, depression and anxiety, narcissistic personality disorder, and associated with depression and anxiety, it comes with severe insomnia, which he demonstrates in the show. In the movie, he lacks a lot of sleep, and so he starts to hallucinate a guy who he thinks is his friend, but he wishes that he could be, almost. The narrator exhibits classic symptoms of depression and anxiety: his insomnia, the feelings of emptiness and meaninglessness, and the detachment from his life point towards the depression. This constant state of unease, irritability, and impulsive actions indicate anxiety as well. These conditions are likely exacerbated by his disillusionment with modern life and his inability to find fulfillment with anything that he does. For treatment options, I would recommend psychotherapy. This would be essential to address the underlying trauma that likely led to the dissociation. Also, I would recommend EMDR therapy for that as well, to really break down the root of why he feels like this and why he feels so detached from reality and everybody around him, his loved ones, his family, his girlfriend. Also, dialectical behavioral therapy could help manage this his intense emotions and the impulsive behaviors associated with both depression and potential borderline personality traits. Depending on the severity of his depression and anxiety, medication is always an option, and it could be beneficial. Antidepressants could help alleviate depressive symptoms, while anxiolytics could manage his anxiety. However, the medication alone would be insufficient and should be used in conjunction with psychotherapy. He should not be taking these medications without also doing therapy as well, and being explained of how to properly take this medication and how it'll work. And there's always a chance with the SSRIs if they will work or not, just because he does suffer with some borderline personality disorders as well. So he could take medication, but I would definitely just start him on psychotherapy or EMDR therapy and break down really the root of his trauma. And I would also probably put him on a sleeping medication as well, just for his insomnia, because I think that's also a reason that he is so depressed and anxious, and that he feels so detached from reality. Thank you.